Good evening, doctors. Today we are going to take a very important subject which is highly scoring, that is orthopedics. That is orthopedics. So, if you answer all the questions correctly, and most of the toppers answer all the questions correctly in this subject, because these questions are straightforward, easy, and you can automatically answer them if you practice them well. So, my request to all of you is to see these videos repeatedly and make an impression in your mind so that in the original exam you can answer easily, automatically, naturally. It will become easy for you to answer these questions. So, I wish you all the best for the NEET PG exam. Identify the instrument: A. Ilicerous fixature, B. Rail fixature, C. K-nail, D. Proximal femoral nail. Correct answer is B. Rail fixator. Identify the given splint. It is a cock-up splint. So correct option here is C. Cock-up splint. Cock-up splint. Cock-up splint is a static wrist arthrosis that can be used in wrist pain, D. Kervin disease, Colles fracture, carpal tunnel syndrome, wrist drop, and hemiplegia. Dynamic finger splint, sugar tongue splint, cock-up splint, knuckle bender splint. Knuckle bender splint simultaneously flexes the MCP of all joint without blocking IP or wrist motion. It is used in case of ulnar nerve palsy. Knuckle bender splint is used in case of ulnar nerve palsy. Dynamic cock-up splint, it extends the PIP, DIP, and wrist joint passively. It extends the PIP, DIP, and wrist joint passively, while patient flexes his wrist and fingers voluntarily. This is why it is called dynamic splint. It is used in radial nerve palsy. Radial nerve dynamic cock-up splint is used in radial nerve palsy and after transfer surgery. Then sugar tongue splint. Sugar tongue splint of forearm is commonly used to immobilize forearm fractures, particularly distal radius fractures at the wrist, and in patients in whom it is desirable to maintain the forearm in some degree of supination or pronation. A football player A football player fall on outstretched hand while kicking the ball and felt pain at the joint immediately after falling. Identify the fracture. It is Galeazzi's fracture. Galeazzi fracture is a fracture of lower one-third of radius with dislocation of distal radio-ulnar joint. Mechanism of injury of Galeazzi fracture is fall on the hand, probably with superimposed rotation force. Radius fracture ends lower third and inferior radio-ulnar joint, subluxates or dislocates. Clinical feature is it is more common than Montague fracture. Striking feature is prominence or tenderness over the lower end of ulna. It may be possible to demonstrate the instability of radio-ulnar joint by ballotting the distal end of ulna. This is known as piano key sign, or by rotating the wrist, So this is a Galeazzi's fracture. What is the use of given instrument? The use of given instrument is to hold the bone and plate. Plate holding forceps. During an open reduction internal flexion, these are used to hold the plate in alignment with drilling and screw placement takes place. Earliest sign of compartment syndrome of leg is pain on passive stretch. What is the most common sequelae of traumatic shoulder dislocation of young adults? It is recurrent shoulder dislocation. So the correct option here is B, recurrent shoulder dislocation. In the fracture seen in X-ray below, what is the most commonly expected vascular injury? The correct answer here is brachial artery. Why? It is a supracondylar fracture. It is a supracondylar fracture. So there can be an injury to brachial artery. What is the eponym of fracture shown below? It is Monteggi fracture. An athlete suffers a fracture as shown in the knee X-ray below. How is the fracture managed? It is managed by tension band wiring. Why tension band wiring? Can anybody comment in the comment box? What type of fracture is this and why tension band wiring? Please comment in the chat box. An athlete suffers a fracture as shown below. How is the fracture managed? The correct option here is tension band wiring. Tension band wiring. Tension band wiring. Which part of second metatarsal is involved in March fracture? It is a neck. Which of the following is incorrect about PCL? It is a main restraint in posterior diet test. It is an extra synovial structure. It is a main restraint to internal rotation. It originates from antagonism. Correct option here is main restraint to internal rotation. About giant cell tumor, all are true except osteogloss giant cell constitute the proliferative component of the tumor. What is the diagnosis? It is a giant cell tumor. This is a very important topic. Read everything about giant cell tumor. Bone tumors are very important. Identify the deformity. Anybody please comment. So easy it is. A. Swan neck deformity. B. Botanist deformity. C. Jersey finger. D. Mallet finger. The correct option here is A. Swan neck deformity. Glucosamine supplementation is given in. We all know it is given in arthritis. Patellar clunk syndrome is present in the superior port of patella impinging on the femoral component during extension. Most specific for diagnosing ankylosing spondylitis is bilateral sacroiliitis. What is the most likely cause of abnormality in the wrist X-ray? It is rickets. A 75-year-old female had a fall and had intertrochanteric fracture. This is due to osteoporosis. A 55-year-old male presents with severe backache for 10 days and urinary incontinence with a history of intervertebral lumbar disc prolapse. There is no history of fever or weight loss. What is the most likely diagnosis? Cauda-Econo syndrome. A patient presents with scoliosis. X-ray shows below. Identify the things. This question has been wrongly framed. I will correct it. What is the likely diagnosis of the image shown below? Coxa-Vaya. Meralgia paresthetica, very important question, repeatedly asked in the INACT exam. It is lateral cutaneous nerve of the thigh. Identify the deformities in the. It is a hallux valgus. Haglund deformity, ankle. So let us now quickly revise all the MCQs. Fast. You answer in the chat box. Identify the instrument given, rail spectator. Identify the given splint. Please answer in the chat box. I will be happy. It is a cock-up splint. A football player for outstand head. There is a Gallagher fracture. What is the instrument to hold the ball and plate? Earliest sign of compartment syndrome of leg is pain on passive stage. What is the most common sequelae of traumatic shoulder dislocation in young adult? Subscapular tendinitis. Recurrent shoulder dislocation. In fracture seen in X-ray below, what is the most expected vascular injury? It is brachial artery. What is the eponym of fracture? It is Monteggi fracture. Athlete suffers fracture, tension band wiring loop. Which part of second motor? It is a neck. Which of the following is correct about PCL? It is the main restraint tool. Incorrect. Internal rotation. About giant cell tumor. Osteoclast giant cell contribute to diagnosis giant cell tumor. Swan neck deformity. Glucosamine supplementation arthritis. Patellar lung syndrome. Femoral component during extension. More specific, bilateral sacroiliitis. What is the most likely cause of abnormality seen in X-ray? It is rickets. 75-year-old female, it is osteoporosis. 55-year-old quad iconic syndrome. Coxa lateral cutaneous nerve of thigh. Hallux valgus, ankle. So in this way, if you practice these MCQs repeatedly, you will be able to answer them very quickly, easily, and automatically. I wish you all the best.